I yesterday went and stirred up a hornet's nest by asking an inconvenient question about Haiti and COVID. And boy, did it cause all kinds of confusion. And this comment or this discussion was on LinkedIn. And this was where it was. It was just simply, this wasn't shared by me, it was shared by someone else, and I reshared it. Experts puzzled by why Haiti has one of the lowest COVID 19 death rates in the world despite administering zero vaccine doses. It's important to note this was in May of 2021. But the point that caught my attention, because what I said in the post was it stopped me in my tracks. How could a country like Haiti, with one of the lowest COVID 19 vaccination rates, 2.7%, and limited healthcare infrastructure, avoid the devastating outcomes seen elsewhere? Why is there so little scientific curiosity? Could the answers challenge prevailing narratives? When science chooses silence over inquiry, it stops being science. And this triggered all kinds of comments. You can see a lot of people responded to it. Some people caught on to what I was saying. Some people were very upset with what I was saying, rhetorical innuendo. Some people got the point talking about Tanzania. Other people were just furious by me even making the inference about it, and you can see all the comments. Please follow me. And the point is that it's an important question. It's a scientific question that I definitely have want to understand. And it parallels something that I had done about 2 years ago. So 2 years ago, I did a similar presentation on Papua New Guinea, countries with high COVID vaccine hesitancy. And I've got an article here from February 2023. And you can read what I had said at that point and the links and why I thought it was relevant. It's in the description. So the question is still, what is it that happened with regards to Haiti? And so I went all the way back to getting the original article that triggered all of these comments. And there it is, Experts Puzzle. This was from May 11th, 2021. And they were saying at that time, health experts have tried to pinpoint the reason Haiti's inexplicably low COVID 19 death rates as other countries continue to struggle to contain exploding numbers of cases and deaths. They just couldn't figure it out. This was right around the time that Delta was starting to surge. And even when Delta came to Haiti, it didn't make a big burst in terms of the numbers. In fact, Katie still has probably less than 900 deaths overall based on the WHO statistics. And as usual, people say the numbers are not real. I mean, I've been hearing this about Africa since the beginning. Oh, Africa is not affected. The numbers aren't real. Of course, these people are dying everywhere. No, there may be a reason that they are not dying. And here is the point, if anyone says that to you when they have no data themselves, all you have to do is reflect on the science. And the science is that when someone has severe COVID 19 and they end up in hospital, it's because they need oxygen. They have to get oxygen. You can't sit on someone at home for 2 or 3 days struggling to breathe and not bring them into hospital. So, in reality, maybe it could happen in very rare situations where maybe someone lived too far away or they deteriorated too quickly. But generally, a patient with severe COVID 19 is going to end up in hospital. Therefore, the numbers are known because the hospital won't miss the diagnosis. Believe me, COVID presents in such an unusual way with the respiratory compromise so quickly that it can't be missed if the person is in hospital. Therefore, the numbers are correct. So, how in the world is it possible? So, just to give you the contrary point of view, that same article, there was a paper or an article in 2023 saying that it was misleading. Lowest COVID-19 death rates despite administering zero vaccine doses. And at the time, they had delivered zero, but they pointed out that 500,000 vaccines have been administered in Haiti, and so therefore they don't have zero. Well, by that time, they did get some vaccines, but there was still a lot of hesitancy in and around Haiti. Additionally, 500,000 vaccine doses, as they pointed out, if people are getting 3 doses, amounts to between 100 to 200,000 people out of a population of 11 million. Whichever way you take it, there are very few people vaccinated in Haiti. So the question is, how did they survive? Because clearly, COVID was devastating the rest of the world. How did they survive? Now, some people may argue COVID is not real. As I said before, COVID was real. I lost colleagues because of COVID. We saw people dying with COVID. So we know what COVID looks like. So it was real. But how could you have an area in the world that has poor health infrastructure, big cities with problems with other diseases, and not be decimated by COVID over the period of 4 years, 5 years? That's my question. Why was this not investigated? I mean, it is so remarkable. Less than 900 deaths across the 5 years in Haiti for COVID is incredible for a population of 11 million people. It's probably one of the best in the world, probably mirrored only by Papua New Guinea. Goodness gracious. The question is, what could be the reason? Some people say it's because the population was young and therefore weren't at risk. Now, I'm thinking if that was the case, if you believe that, you should be shouting on the rooftops saying that they shouldn't have been giving vaccines to young people across the world. How can you single out one region and say they had no risk because their people were young, but in other regions you're vaccinating young people? Makes no sense. But this is what happens when things are ideological. People just can't get their head around unusual situations. It's kind of like saying it's raining and our group has up umbrellas and therefore we are dry. But then you have another group who had no umbrellas and they are dry. That doesn't make sense. You should try and understand what is going on. How does it fit? If you are saying that this intervention did such an incredible job at saving millions across the world, explain Haiti, explain Papua New Guinea, explain Africa. What was it that differentiated these regions? So, as I said, my first point is that it's not that COVID wasn't serious. I know, I understand the mechanism. I see what happens in severe lung disease. We see how quickly people can deteriorate. So, it was real. But could these places have had a secret sauce? Something that protected them that would have been of benefit to the rest of the world. Or maybe, as I said, vaccines are only beneficial in first world countries. Poor countries somehow are immune to the benefits. I have no idea. Well, let's get into the science here. So, as usual, I'm asking a question, and I suspect I have got the answer. Now, you have to know that before I start explaining what I think, there have been no detailed epidemiological studies here. And so nobody actually knows the answer. So I can give my opinion and I'll explain why I think my opinion is correct as to what happened in Haiti. Follow this here. There is a condition in the world called lymphatic filariasis. And essentially, these parasites destroy lymphatic vessels and cause lymphedema. And there are certain parts of the world that it has endemic circulation. And so this document is part taken from the WHO global program to eliminate it. And this report was from 2018. So this is before the pandemic. But I'm highlighting to you that this work is ongoing. Now, what is it that they are doing? And they are targeting mass distribution. And I want to make sure I get the explanation of MDA, which is mass drug administration. That's what they were doing, mass drug administration in specific countries. MDA comprised treatment for all eligible people living in all endemic regions, recommended specific regimens of, oh my goodness, what is that? Ivermectin, did they say that? Diethylcarbamazine and albendazole. 3 drugs. Now, therefore, what's the connection with Haiti? Well, when we look across the world, there are certain regions that have this as endemic. The regions are in Africa, Angola, Chad, Democratic Republic of Congo, Madagascar, Nigeria, South Sudan. In the Americas, there is only Guyana, Haiti, and there is some spread in Brazil and Dominican Republic. And so you know straight away that this use in that particular region is not common for the Americas. And when we look at the numbers, and this is from the WHO, again, document from 2018, looking at the total population requiring it in 2018, and this is 341 million in Africa. And you can see they're going down all the countries that had it in Africa and the different numbers. Nigeria had big numbers as well. In the Americas, it was about 6.5 million. And for Haiti, it was 5,771,000. So they were using this very, very highly in Haiti. And so not only were they using it very highly, but Haiti was congratulated by the WHO because when you look at the numbers, what you can see happening in the Africa, this is percentage penetration down here. This is 30% here. So just below 30% in Africa. But in the Americas, including Haiti, it was over 70%, 71% actually. You can see it's up to 83%. And they knew that there was up to 71% penetration in Haiti in about 2012 to 2015. This is very, very important. So this is what I mean when I say that if there had been proper investigation, looking at the pattern, thinking about the epidemiology, and comparing the outcomes in Haiti to other parts of the world, it should have gotten the scientific community to go, listen, that is very unusual. Now, of the 3 drugs that they administered, there is one that stands out. And there's a reason I'm going to explain to you the science, because this is part of the problem. Too many people don't understand the science. And because they don't understand the science, they discount it. Very often, the question is not if something works, but why does it work? That's the important question. So of the 3 drugs that they are using in endemic regions, this one that rhymes with pectin stands out the most. Diethylcarbamazine, no. Albendazole, probably no. But this one, which is a remarkable drug, is one of those drugs that has multiple uses. And the question is, could it have been contributory to these remarkable outcomes in Haiti, and why? That's the question. Now, this is where the science comes in. So you have to work with me here. And so in order to understand, and what's interesting about what happens here, this benefit is that in reality, it's not just relevant to this particular drug. If you understand the science, you will understand why this works. So here we go. This is taken from a paper called SARS-CoV-2 Replication in the Airway Epithelium Requires Motile Cilia and Microvilli Reprogramming. It was from 2023. And they grew these cells in culture and then infected them. So they got to study in detail what was happening with the virus. So look carefully at what happens. When the virus invades the upper airway, it binds to the little hairs on the surface of the cells that sweep mucus. So this blue part represents mucus. This cream part blue part represents air. The cream part represents mucus. And the normal surface of the cell has these little microvilli, tiny little hairs as well. So the cilia sweep the mucus, the microvilli do other functions. When the virus comes, it binds to these hairs, then it hijacks, jockeys all the way down, then it infects the cell. But then it has a problem because even though it has infected the cell and it's replicating, it can't get past the mucus. So what does it do? It reprograms by interfering with these proteins, PAC1 and PAC4, it reprograms the microvilli to become like trees. And so they just suddenly go above the mucus. And so now suddenly within 48 hours, the virus can spread avidly and it just can keep on producing and spreading. And then it does the same with other cells and so on. This is one of the most important aspects as to how the virus works. And that's how it spreads. Now, there are other ways that Omicron spreads. Omicron also spreads not just from the microvilli, but from cell to cell. But that's not as efficient as sending millions of little particles to infect multiple cells around and critically to infect other people. This is now where the critical science comes in. Guess what? PAC1 is impacted by ivermectin. And therefore, what it would mean is the capacity of the virus to cause the microvilli to grow is impeded. It therefore means a slower period of time before it can then spread. So instead of, say, 48 hours now, it may take 4 days. In that period of time, the immune system has time to respond. It's more likely to get an interferon response and destroy the cells that are infected. And so therefore, it's not that infection doesn't occur. It occurs more slowly. There are less viral particles that spread because there is an impact on PAC1. What's very interesting is that there is a cumulative impact on PAC1. And I just want you to remember what the PAC1 is from the image, is that a cumulative effect of inhibiting this process of the tree-like microvilli can also be done by vitamin D. And this is part of the reason why vitamin D would have been effective, not to stop infection, to slow the ability of the virus to spread. That then has an impact on the severity of the disease and the ability to circulate in the population. That's how science works. Now, somebody will say, there is no evidence that this was the reason. I understand that. But you haven't done the research. All we know are these facts. The facts are Haiti only had about 2.7% of its population vaccinated. That's the first fact. So therefore, 97.3% were unvaccinated. Based on the premise that the vaccines saved millions of lives, we would have expected more than 900 deaths across the 11 million people. Some people may again say, well, there is no evidence that only 900 people died. I argue, if you haven't got evidence that says there are more people in hospital with COVID because they had limited infrastructure, the doctors would have known who had COVID because it presents in such a very clear way. Almost all patients will end up in hospital with severe COVID. And so, therefore, I believe that the 900, even if it is a little bit off, it won't be much higher than that. Therefore, such remarkable outcomes in a country that has widespread use of a drug to target lymphatic filariasis, which could also impact on PAC1, makes perfect scientific sense to me. The problem is that at that time, there was no incentive to find solutions. And even now, acknowledging that something like that could work or be beneficial at population level is not convenient news. For those who are stuck in an ideology and a narrative, who are not actually interested in science, these discussions are very uncomfortable. As I said, and I'll take you back to what caused all of the problems in the recent bit, was just me sharing a simple question when I shared it on LinkedIn, and it just blew up. 418 people responded. Some people laughed, some people were upset, some people questioned, but it raised the question that should have been answered then, still needs to be answered now. There's still a long way to go with the science, but we can't afford to let it go, because if we do, the same mistakes will be done again in the future. Remember, if you want to see what happened with Papua New Guinea, take a look in the description. I've got the link there on my Substack. Have a great evening.